Thank you very much. My name is Professor Bello Abubakar Mohammed. I am a clinical and radiation oncologist and also a researcher. I'm the president of the Association of Radiation and Clinical Oncologists of Nigeria, and I'm also the past president of the African Organization for Research and Training in Cancer, IOTIC. I'm happy to be here. Like I said, I'm a researcher and I'm involved in quite a number of research, especially around genomics. Where I've been involved in the 54 gene research, where we look at about 54 genes that are responsible for some of the cancers that we have in Nigeria. And currently I am the principal investigator of a very important study called the ICM, which stands for Innovative Cancer Medicine in Metastatic Colorectal Cancer in Nigeria. This is the first of its kind in Africa, where we are looking at feasibility and adaptability of nivolumab as an immunotherapy for patients that are microsatellite instability high in sub-Saharan African cohorts. This has not been done before, and I'm glad that this trial has commenced since October last year, and we are going to recruit about 30 patients where we will be administering nivolumab every 2 weeks for those patients. We have already recruited almost 20 patients out of the 30 patients, and they have been receiving nivolumab 240 milligrams every 2 weeks. The interesting part of this is that this is all free. It has been being sponsored by international partners, namely PICE, which is Parker Institute for Cancer Immunotherapy, that is funding the study, and BMS also is providing all the nivolumab at no cost to the patients. So the patient are getting the treatment for free, and every investigation is being covered by PICE. The testing, which is the microsatellite instability testing, is also conducted at the National Hospital and is 100% sponsored by Roche. So the people that are the go-between are the Clinton Health Access Initiative. So by and large, this is a study that is 100% supported by partners from around the globe, and it is being conducted at the National Hospital in Abuja, Nigeria, which is the Apex Hospital, where I am the principal investigator. We're so happy to note that already we are getting excellent results, even though we have not given the preliminary data. But I can tell you from the clinical aspect that patients are happy and they're getting better day by day. So as we know that personalized care is the way to go in every cancer, and also especially in colorectal cancer when it is even metastatic. That means it has spread. Now there are quite a number of biomarkers that are being used for colorectal cancer. The KRAS is a group of biomarkers that can actually be used to ascertain whether the patients can benefit from what is called anti-EGFR. So you have the KRAS, you have the NRAS, and when they are mutated, then the patient will not benefit, right? And when they are not mutated, that is the wild type, then the patient can benefit from some of these anti-EGFR, such as cetuximab or panitumumab, as the case may be. Of course, there are other things like the BRAF mutation also, where when it is mutated, patients can actually benefit from anti-BRAF drugs. You also have the HER2 type that will benefit from anti-HER2 drugs like trastuzumab, deruxtecan, and so many other drugs. And then Now in the era of immunotherapy, we do what is called the microsatellite instability testing. So those are patients that can actually express or they have mismatch repair deficiency. Those are the patients that can actually benefit from a lot of immunotherapies, nivolumab, ipilimumab now that is also in the guideline, and so many others. So, and of course, for those that have microsatellite stability also, you can do tests like the tumor burden to see if it is expressed. Those patients can also benefit. So these days we do personalized care. When you are able to do all these biomarkers, you should be able to treat the patient even when they are metastatic, and you can get fantastic results.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.